So in the interest of time, I am now going to hand things over to Danielle Bonadies, one of our forum co-chairs who you met earlier, and she is going to chair this session this morning and introduce who we're going to be hearing from.
Great, and thank you so much, Kate. There are links posted in the chat in case anyone needs to navigate to another area, but it is my pleasure as the mom of a 4-year-old with NF1 to introduce you to the Pediatric NF1 session. Our first speaker is Dr. Karen Walsh. She's a pediatric neuropsychologist and the Associate Professor of Pediatrics and Psychiatry at the George Washington University School of Medicine and the Children's National Health System. She's a neuropsychologist to the Brain Tumor and Neurofibromatosis Institutes at the Children's Hospital and provides clinical neuropsychological evaluations and consultations to a variety of pediatric populations, including NF1 patients. So today we're going to hear from Dr. Walsh about NF1 at school. Welcome, Dr. Walsh. We're so happy that you could join us today.
Hi, good morning. So I'm going to share my slides because I'm one of those folks that didn't send them along. So let me get that going. Can you see my slides? Okay.
Thank you.
Great. So first, I thank you guys very much for having me yet again. This is absolutely one of my, I wish we were in person because it's definitely awesome in person. The forum is one of my very favorite things to do every year, anytime I get to go and be with the families and the kids and speak about something that hopefully is helpful to everybody. It's really my absolute favorite thing. So thank you very much for having me again. You know, NF1 in school is not a new topic, but it's a little new this year. So I wanted to try to keep, it's not super short, but I kept this a little shorter because I really like to have conversation and questions. So I wanted to leave some time. So I'm going to jump right in and hopefully we have enough time to have a little discussion because I think everything that's happened with COVID this past year has really had us all a little bit of in a tailspin. I think in particularly our NF families and kiddos who may have already had some needs, you know, that produces some unique challenges or things that we have need to think through and need to figure out. So that's my goal today, is to try to give us a place to chat a little bit about that and teach you a little bit of what I've learned so far as it relates to COVID. So, you know, when we think about school is the full-time job of children, right? That's normally where they are all day long and where they spend a good portion of each day. In thinking about, you know, what do children do at school? I mean, obviously learning is the why they're there. So learning is a big component of the day, but there are also other things that children do at school. Play with each other on the playground, which is also, particularly in young children, a way of learning and an important way of learning. They may participate in sports or other kinds of activities at school. They certainly are there and developing friendships and learning how to socialize. So there's a lot going on at school. There's a lot of things that kids are trying to navigate and learn skills around beyond just reading, writing, and mathematics. So there are, you know, several factors specific to children with NF1 that might impact their functioning in these different areas. And I'm going to list these here, but really break them down a little bit. A lot of this won't be new to you guys, but just sort of, you know, my goal is really thinking about, and we'll have a slide about thinking about the whole child and the whole environment, you know, not just one aspect, and how things may be working together either for or against that particular child. So, you know, in NF1, we certainly know that neurodevelopmental disorders are more prevalent, academic challenges, or even specific learning disabilities, certain neuropsychological deficits, social emotional difficulties. And then I think, again, there's been a new layer with COVID-19 in terms of how to navigate some of these things. So in terms of just some background, you know, with neurodevelopmental disorders in general, you know, we have this category of like 80% of kids with NF have some kind of cognitive challenge, I guess. It's not very specific. It doesn't really, we're not talking about a specific thing, but it just means, you know, somebody sort of has some struggles, may not always feel like things are going so well in the school setting. While intellectual disability, or what used to be termed mental retardation, is not super prevalent in NF1. It is more prevalent than in the general population, which is closer to 1%. So some kids are affected in that way, where they have very low intellectual functioning and they would have different needs than other children. Specific learning disabilities, and what we're talking about here is reading, writing, and mathematics very specifically. So what we call also dyslexia and writing disabilities can be seen in anywhere from 20 to 50% to half of the NF child community. And ADHD, similarly, 30 to 50% of kids are affected by ADHD. And then, of course, as everybody in this community knows, over the last few years, we've really been examining the prevalence or presence of autism spectrum disorders in NF1 and have shown that to be more prevalent than the general population. So that also can impact, a day in school for a child. When it comes to specific learning disabilities or academic achievement areas, again, in a general way, about half of our kids with NF have some kind of academic difficulty. About a third have repeated a grade at some point in their school career, and about half receive some kind of special education services. Reading and math disabilities around 20%, which again is higher than the general population. We really don't have numbers for writing disabilities. It's not very well studied or evaluated often. And then just a couple things about comorbidities, that we know that males tend to have more specific learning disabilities, and that ADHD can certainly impact reading and be associated with reading disabilities. And this isn't for everyone, but these are just some themes that you find when you're trying to understand. In terms of specific neuropsychological deficits, which you might be thinking, how are these all different? They're really not. This is all your brain working. So, but the way that we think in neuropsychology is, we're really trying to put the puzzle together for each individual child that we're evaluating and helping, because every NF child is unique, despite understanding themes about the NF community. These all aren't true about every child. So what we have to do is figure out what are the positives, what are the strengths of this individual child, and what are the areas that might be creating difficulties for them. So in the neuropsychological area, executive function is a really big area that can impact kids in all different ways. Again, whether that's in learning, socializing, or doing other things like play. Attention, that whether you have trouble engaging attention, sustaining attention, shifting or altering your attention towards something you need to focus on, any one of those areas or all of those could be impacted for children with NF1. Working memory is a very big one, and it is important for lots of skills. So working memory is our short-term active memory process. It's sort of, I like to think of it as like a mental notepad a little bit. So when kids have trouble here, you'll hear families or teachers saying they have trouble following directions. They can't remember what I've told them to do, or they only do one of 3 things I've noted, or these are some good examples of working memory difficulties. Working memory, though, is also important in things like reading comprehension, certain aspects of mathematics, writing, because you have to be able to hold a certain amount of information kind of in your mind while you're working. And that's really what this process does. So if you have trouble here, it's particularly notable and will kind of create some barriers for kids. And that's why we try to come up with ways to work with that. And finally, planning, organization, time management, and general management, like, do I have my stuff? Am I on time? Am I organized? And flexibility is another one that can be impacted for kids with NF1 that can really cause some difficulties in terms of an inability to kind of go with the flow, if you will. And I think that's been particularly probably notable in the COVID era here, that COVID has really required all of us to be quite flexible and work with the unknown. And so for some kids, this may have been particularly difficult this year. And for some of us families. And on the flip side, it's helped teach some flexibility for some of us. So there's kind of 2 sides to the coin with COVID. Nonverbal visual spatial skills, like visual spatial processing, and then certainly motor issues, that's very prevalent in NF1 from early on. So that includes speech, fine motor actions like writing or, doing puzzles, doing things with your hands, and also gross motor, so running, jumping, your balance and coordination. And so these are all things that, I have certainly heard families talk about, kids that maybe can't participate on the playground with their peers because of some motor limitations, and that causing some, difficulty in connecting with children, or that speech is a particular problem and other kids can't understand them and they get very frustrated and, repeating themselves all the time. So these are other areas that can impact a day in school. And then finally, language, expressive, the way we express ourselves, and our comprehension or receptive language. And that's not just in conversation, but also in reading. Are we comprehending what we're reading? And also in expressing ourselves on paper. So these can also, and those are all necessary and expected at school. And especially as we get older, as kids get older, the expectation for that being a very smooth and automatic process is there. And if for some child that's not, then that can create some challenges. So, and then in terms of social emotional challenges that are common in NF1, again, we talked about the presence of spectrum disorders, but even in those children that don't meet criteria for autism, which there's plenty of, we have known for a long time that there are some social, what we call social or social cognition difficulties we can see even if a child does not have autism. So that's the most prevalent things we see are like with perspective taking. So that's or a child's ability to kind of put themselves in somebody else's shoes. So in an interaction, can I understand what that other person might be thinking or feeling by looking at their nonverbal language and kind of taking cues from that and understanding how, and then adjusting my own behavior based on how I think the other person is experiencing something. So kids with NF aren't particularly great at that often, and that causes some challenges. There's some nice research on facial emotion recognition, and that kids with NF can have some difficulty processing facial emotions, particularly like anger. So again, you think about them interacting with their peers or other people. If you really don't, if your brain doesn't really pick up that cue, then it's hard for you to have respond to maybe if somebody looks like they're getting angry, but you're not picking up on it. So you're still maybe doing the same thing and they're getting more and more frustrated or angry, can obviously make it hard to navigate socially. And then just understanding social cues, jokes or sarcasm, that's not particularly strong in a lot of kids with NF1. And then just psychologically, I think this is an area we still know very little about and need to know more about, is the presence of anxiety or mood disruption and how that can impact a school day. And that can impact learning, socialization, it can impact everything. So, again, back to sort of what I said earlier, I think considering the whole child is really important because every aspect of how one is doing can impact a day, impact a skill or a function. And success is sort of the result of all these things sort of integrating and working together. So when we have an area that's maybe not either developing typically, or there's some environmental reason for, other things going on, then that can kind of alter the balance here that we have. And again, this is all these areas, mental health. And I think that's been a big topic this year with how kids have done with this pandemic and being in the home, cognitive and academic development, social, emotional development, their physical health, so sleep, nutrition, generally physical health. Some kids need to be out for treatments and, there are other needs they have physically that can alter things. And identity development, I don't really get into today, but really just kids' ability to, as they're getting older, figure out who they are and know who they are and advocate for themselves. And these are all important and all work together in terms of whether someone's having success or not. And disruption to any of those areas can kind of, again, disrupt the balance. Okay, so this is a familiar picture. And I went and did a little bit of research to see what's out there so far in understanding how has COVID-19 and what's happened with a lot of our schools, is there an impact? What do we know so far in terms of how that may have affected development in certain areas? So these first two slides I'm going to show you are not NF specific. This is a general kind of study that was done. And I'm happy to share all these slides because I have links to a lot of stuff in the slides that you guys might really like to go take a look at and a deeper dive into. So Kate can certainly send these out if she wants to. So what this slide is showing us, just to orient you, so this is reading specific. Okay, so they looked at reading and math. The dark blue in these graphs, these distribution graphs, are going to be from COVID, sort of the winter session before COVID really emerged. And then the lighter blue is sort of after. Okay, so they're trying to look and see basically how are kids doing in reading before and how are kids doing in reading after. And so you can see there's a little bit of a gap here between them. This blue, darker blue is really behind, and you don't see too much, and especially not as the kids got older. So it seems like reading is not particularly disrupted in this past year in terms of progress and development, slightly, and certainly at the younger ages. But then what we see with math is actually more concerning. So math seems particularly susceptible. And this makes sense to me, to be honest, because reading is a much more, I guess it's, we kind of call these sort of more crystallized, like language skills are more crystallized skills, meaning they're a little less susceptible to from various things, but mathematics and other kind of nonverbal things can be a bit more susceptible. So this kind of follows that logic to me. So there's two things here. I'll start at the bottom because it's similar to what we just looked at with reading. So on these bottom distributions, same ideas we looked at, but this is with mathematics. And you can see there's a bigger gap here from pre to post-COVID in terms of that distribution. Again, more so for these younger age groups, elementary school, but you still see it even in the middle school heading into high school. And then the top graph is map testing in mathematics. So the percentiles of kids. So the dark blue is pre-COVID, the last time they were tested pre-COVID, and then the new testing post-COVID. So you can see that there's some real changes here, or a lack of maybe progress that looks like math is particularly susceptible. So if you have a child that had a math disability already, I think this is something we'll really have to be thoughtful about. We'll have to be really talking to schools about, what is the remediation plan going to be to try to get kids caught up, because these are just the general population. So these are kids without disabilities are showing us this. So we don't know what it looks like in kids that may have had math disabilities prior to COVID. I just want to throw this up there because I want everybody, I think as a clinician, we've struggled to figure out what is our advice to families with COVID once this is over, and what do we, even during, like, what do we do? What should our expectations be of schools? What are our rights? What are our responsibilities? And I just wanted to put this out here. There's a couple good pages from the Department of Education. And really all this is getting at is that there's no break from providing special education services for children that have IEPs, that whether you're in person or not, the school does have a responsibility to ensure that a child is getting their, and this is public school, of course, free and appropriate education. I think people will have various opinions on whether they felt like that happened or not. And certainly from families I've worked with, it was clear that certain therapies or interventions were more amenable to virtual platforms and others were not. So speech language, reading interventions may have been able to be continued, at least in some way, virtually, but things like occupational therapy or physical therapy or certain other things was not, and some children just didn't get any of that for some period of time. So to me, going back in the fall here and prior to going back to the fall, it sounds like a lot of kids are going back into the classroom. I think this is a sort of refresh of time for, I think, every kid who has an IEP. There should be an IEP meeting. I think we have a lot to figure out about what's gone on and where we are. So mental health, I'll just spend a couple slides here on the mental health side of things. This again is not NF specific, but they've done some surveys and really trying to get a sense from parents, like, how do you think your kids are doing since the pandemic? And you can see that sort of a little over 20% feel in general that their kids are having more difficulties mentally or emotionally, or that their mental health is not as good as it was before. And then it breaks it down, a little bit with just more psychological stress, anxiety, and depression. And again, I have links to these organizations that are starting to try to look at this a bit more. So we know, and there's been obviously a lot of discussion on the news and on television and online about increase in depression and other symptoms, mental health symptoms in children and adults during this time. So I think these are the things we need to also address and figure out. This actually is, again, not NF specific, but is specific to children, the mental health of children with special needs and their families. And so this was a nice kind of article that really did a survey and asked kind of people, how are you doing? What are the things that have gone on in this past year when it comes to your mental health and your child's, again, in children that have special needs. So a lot of participants talked about worry, both the child and the families, worry about themselves getting ill, a family member getting ill or dying from COVID, and just general worry about what's going on here. I think there were a lot of unknowns, and most humans don't like unknowns, but particularly kids with special needs who may not have flexibility really don't like unknowns. Loss, and this wasn't so. They weren't reporting loss of people we love, but that certainly is something that some people have lost someone. But this was about loss of support. So, and routines and specialist input, like therapists and teachers that were in the school and interacting with our kids in person. You know, there was a lot of loss of that just daily connection, and certainly the routines. I mean, I think any of us that are parents certainly knew that we had to rework routines in the most massive way ever we've experienced last spring. So it was a big deal, and that's a big deal for kids, again, that have special needs. Mood, emotions, so changes in mood, feeling down, and changes in behavior. So one thing I always say to parents is kids communicate by behavior. They're not always great at saying how they feel, if they're sad, scared, mad. Some of them can do that, but more often you're going to see it in a behavior. So our job, you know, in helping families is to often look at and get descriptions of behaviors and try to figure out, what is this kiddo trying to tell us? You know, how it usually can tell us a lot about how they're feeling. And then we can help them to learn ways to communicate that to us in, you know, more proactive ways. But changes in behavior are common, especially if kids are nervous, anxious, sad. The other areas are overwhelmed. I think that's clear for all of us, right? Responsibility, everybody being together all the time, which at first seemed like, this is great, we get to be together as a family. And then you realize, like, that's a lot of time together. So there's no respite, there's no break for anybody. And I think everybody needs time in their own space. So that really, you know, COVID did not allow us much of that. And just feeling generally stressed. The understanding of the situation, you know, for a lot of kids, again, it was scary and confusing. And for a lot of adults, it was scary and confusing. And we didn't know what was next. We got new information daily, and just trying to stay flexible and keep adjusting with what we knew the next day, you know, took a lot of energy. But I do want to say that there's this potential positive side to COVID. And I will say I'm probably like a annoying optimist to some people. Always been a half fool kind of person, but I've seen a lot of positives come out of COVID as well, for families, for children, in my life. And so this is not to suggest this was not a big deal and not a very stressful time for everybody. But I think there are some positives that have come out of that. And this survey also did indicate some of that from our families with special needs. And some were describing things like kids who had a lot of social problems or had a lot of anxiety about going to school. That COVID sort of actually took away some of that distress that was associated with those things, getting a kid out the door to school. And so, you know, depending again on the situation, there were some positives that happened. And I think even families I've worked with talking about learning in the virtual environment, while quite challenging for families, especially as you're trying to work and do your own things, we really got a unique window into our kids in a classroom, if you will. I mean, I certainly felt that way, eavesdropping into the class to see, like, how does my kid do? What are they doing? What is this teacher like? And so to me, there were some opportunities to think about, how can we go moving forward? I think we have an opportunity here as we go back into schools for making it even better. And that's going to be based on what we've observed and what we've been able to see in our kiddos, good and bad, over this past year. So just, you know, I never can think of all the recommendations. So I just put some general things out here. When we work in neuropsychology, as you've heard earlier, it's very individualized. We're really looking at families and children uniquely in our office and coming up with very specific recommendations for them. So these are going to be pretty general. But I would say definitely know your rights and responsibilities. Go do some research online or use some of these links that I can provide you and understand, like, what should I expect from my school? Is my school going to expect of me? What are my rights? What are my responsibilities as we move forward? The second is really I know everybody has different experiences in their school systems, hopefully mostly positive, but I know that's not always the case. But communication and collaboration is going to be a key factor here between families and schools as we get back into school and try to figure out where are we and what does the future need to look like this next school year. I've recommended to all my families I've seen over this past year for evaluations to jot down everything you've seen in your work with your child as their teacher for this year. What's worked, what hasn't worked? Because I think some families definitely have seen that with certain approaches, whether it's breaks or it's certain kinds of supports or it's presenting information in different ways, because families had an opportunity to play around a little bit with some different ways. What worked? And that's a really great start point from my perspective to a meeting with a school to say, we really had a nice opportunity to observe our son and our daughter, and we did these couple things, and that really seemed to make a difference for him or her. And then on the flip side, what didn't work at all? My kid really doesn't do well on the computer all day like that. So, or whatever it was. And I think you take that into that meeting to start the brainstorming and generation of ideas process. The fourth, really take care of mental health needs. And, for everybody in the family, I always think people can benefit from that. I think that's particularly relevant now. And then just keeping things in perspective. Good enough is good enough. It's okay. None of this looks perfect in a regular time and certainly not during COVID. So I always tell families, give yourself a break. We're all doing the best we can, and that's all we can do. So keeping that moving forward. And I see Danielle's up, so I must be pushing my time limit more than I wanted to. Let me stop sharing this. Okay, Danielle. I always have way more to say than I do in my practice talks. Sorry, everybody.
Exactly. There's so much to cover. We do have a few questions in the chat, so we are at time, but if you wouldn't mind checking those out, that would be great. You can
sorry. I really wanted to talk to you guys more, but I think I just need like a couple hours one of these forums just to hang out and chat.
Thank you so much for being with us.
Oh, thank you. I'll definitely get in the chat and answer the questions.
So it is now my pleasure to introduce Allison Getch-Weissman. As a genetic counselor, it's really an honor to introduce a fellow genetic counselor. So welcome, Allison. She is the Assistant Professor of Pediatrics at Northwestern University Feinberg School of Medicine and a pediatric genetic counselor in the Division of Genetics, Birth Defects, Metabolism at the Anne and Robert Lurie Children's Hospital. She's the clinic coordinator of the neurofibromatosis program, and she spends her research time understanding and improving the healthcare transition and readiness among teens and adults with NF1. So Allison, welcome. We are very excited to hear more about the transition from pediatric to adult care in NF1.
Thank you, Danielle. I'm really excited to be back at the forum and also really honored to speak after Dr. Walsh, and I think she set the stage really well for me. I do want to warn you all that in Chicago, it is storming really terribly right now, and we're in a tornado warning. So if someone could please just let me know if I'm having a bad connection. I can always turn my video off and hopefully you won't lose me. Okay. So we're going to talk about transitioning from pediatric to adult care. I don't think I have, there we go. Okay, thank you. I do want to let you know that some of the research results I'm going to be discussing today were financially supported by a grant through Children's Tumor Foundation. And today I would like to talk about, what is healthcare transition and why is it important? What do we know about transition readiness among individuals with NF1? And then introduce some of the amazing existing transition resources, but also highlight the need for us to create additional resources. So what do we know about the transition to adulthood? There's been a lot of research in this area, and we know in general that individuals who have complex medical needs or have a genetic condition, that can make, everyday kind of adult experiences more difficult, like, having a paying job, being able to pay your bills on time and save for retirement, live on your own, develop meaningful social relationships, and have a family. And a lot of research was done prior to 2012 that highlighted the need for additional support programs and services for adolescents and young adults with complex lifelong healthcare needs in an effort to improve quality of life and promote future independence. So that's basically saying, yes, we need to have better healthcare transition process, but healthcare transition was actually coined back in 1993. So it's been almost 30 years since somebody came up with this idea in a more kind of defined way. And they said that healthcare transition is just a purposeful and planned movement of adolescents and young adults with chronic physical and medical conditions from a child-centered care to an adult-oriented care system. And research among individuals who have complex medical conditions demonstrates that the need for improving this process is there. So it's really disorganized. Oftentimes individuals transition to the adult care world and they don't have the appropriate insurance coverage they need to access the care that they require. And so that can mean that people are not getting the care they need. And if you're not getting the care you need, we can have a decrease in your positive health outcomes. So people could not do as well with their health concerns. And then if you're not doing as well with your health, that might start to impact your education, your employment, and even your socioeconomic status. So the goals of healthcare transition are to, 1, eliminate gaps in the provision of care, to 2, increase positive health outcomes among those with complex medical conditions, and 3, improve quality of life. Those are a lot of, very technical terms. And I kind of think, what does that actually mean? It means that you or, your teen, your young adult need to understand your diagnosis and your unique medical needs, that we want to keep you as healthy as possible, and that we want you comfortable and confident going to college or living on your own. So making that next step after you become an adult. So how can we make this a success? First, we need to know what matters to teens and young adults who have NF and schwannomatosis, and what do they need for their everyday life? And then we need to design programs and resources that are going to prepare for that process of transitioning into adult life. And we need buy-in. We need buy-in from the teens and young adults and from their parents. Can't do this on our own. So there has been a little bit of research that is on transition in the NF world. So I worked with an amazing group of women to design a study that was the first to assess transition readiness among adolescents and young adults with NF1, and we'll be going through those results today quickly. And then Dr. Strumpf and her team do have a manuscript in preparation where they also assess transition readiness among adolescents and young adults with NF1 and plexiform neurofibromas. So she gave a great presentation on this at our conference for clinicians and scientists, and hopefully this will be out soon for everyone to read. Unfortunately, there is no formal data on transition readiness among individuals with NF2 or schwannomatosis, but I hope we can change that. So I just want to introduce my study to you. We have the goals of assessing just if individuals have healthcare self-management and transition-related skills, and then explore how that potentially impacts their young adult life. So not just in the healthcare setting, but with education, employment, relationships, and family planning, and then try to figure out, is there any relationship between those two things? And our outcomes, or what we were hoping to do, was what we've already kind of talked about, which is design programs or interventions to help with this and make sure that providers and clinics can provide the support that's truly needed. So we recruited through the NF registry, through informational flyers that are in the NF clinics across the country. And then also perhaps some of you were wonderful and volunteered to post in the NF1 Facebook support group. So thank you to all of those of you who may have done that. We recruited anyone between 14 and 26 years of age who had a self-reported clinical diagnosis of NF1. And unfortunately, it was limited to English speaking and reading participants. And it was an online survey that they were able to complete within 10 to 20 minutes. And we had 4 different sections. So we asked about demographics, we asked about transition readiness, some NF1 specific transition readiness, and then young adult life. This is the Transition Readiness Assessment Questionnaire, or the TRAC. It is a validated tool that has been around now for about 7 years. And you're able to see, from the screen that it asks the teens to kind of self-rank where they're at with each skill in these 5 domains. So with medications, appointment keeping, tracking health issues, talking to their doctors, and managing their daily activities. Do they not know how to do something? Are they learning to do something? Are they able to do it on their own without any parent or guardian support at all? So it's really a non-biased way to assess where is somebody at in learning each of these skills. And since that is not specific to NF, we decided to design our own non-validated track that did ask questions about things we felt were important for teens and young adults with NF1 to know, and things that we as providers would want to know. And then we asked about, are there other factors of young adult life? So quickly to go through our results, most individuals we had 101 people respond, which I think is pretty good for teenagers. Most individuals are between 16 and 21 years of age with an average age of 19. They're not very generalizable results because most people reported that they identified as female, white, lived within or near a city, had no family history of NF1, lived at home with their parents and siblings, were single and students, and had private medical insurance. So it clearly doesn't represent the entire NF1 community, but it was a start. And we did find that individuals who participated did have a significantly lower transition readiness score than their generally healthy peers. And we saw that individuals who were older scored higher, so had better transition readiness. That makes sense because these are learned skills. And that female participants did score higher than male participants. And in NF1 specific transition, we asked about knowledge of NF1, knowledge of their NF1 care team and information, genetics and inheritance as well. And just to kind of break it down, we did see that there was good self-reported knowledge in knowing their symptoms and why they see their NF1 doctors, but we had lower reported scores on the right-hand side of the screen with knowing what to do in emergencies and how to talk to people who aren't their NF1 care team about NF1. And again, we had pretty good skills with some of that information, like how is NF1 inherited? Is there a risk to pass it on to your children? And slightly lower scores, but still pretty good for knowing about birth control and protection from sexually transmitted infections. But overall, 38 to 72% of our participants reported being unable to do an NF1 related transition skill well or know each item well. So it told me that we have a long way to go and we do need to target these things in clinic and outside of clinic. Tasks that were particularly difficult for the individuals who participated were handling NF1 related medical emergencies, explaining NF1 to their non-NF1 care team. So the doctors and providers that they see that are not in their NF clinic or in their NF kind of care family. So maybe that's their pediatrician or a doctor they see for another reason, but also explaining NF1 to their family and friends, how to contact their NF1 care team. So if they need to make an appointment or ask a question, how do they even get a hold of their doctor? And then keeping copies of their medical records, whether that's electronic or paper copies. And this slide is pretty busy, but I just wanted to show you, since we did develop our own tools, that there was a correlation between generalized transition readiness and NF1 specific transition readiness. So the higher someone scored with general transition readiness, the higher they scored with their NF1 specific transition readiness. And that's a good thing. Now, moving on to some of the factors of young adult life, you can see here that the 2 darker blues represent individuals who reported that NF1 had a significant or some impact on each of these areas of life. So you have close to 70% of individuals reporting that NF1 has some or significant impact on their education or school plans, their career and job choices, and their relationships, and closer to 85 to 90% of individuals saying that NF1 had some to significant impact on their family planning. And we saw that the greater the self-reported impact of NF1 on education, career and job choice, and relationships, the lower their overall transition readiness was and their NF1 specific readiness. So this just shows us that we have to take into account that transition is not just in the healthcare setting. And with education, and I think you just heard a lot about this from Dr. Walsh about how this is so important. We did see a significant impact, and it's consistent with the literature. And we also heard, some of the things that our participants were telling us is that they chose to attend college near home, so they could live with their parents or they could be near their care provider. And some individuals chose not to go to college or took a break from college due to their NF1. And with employment and careers or job choice, we also saw that there was a significant impact here, where a participant said maybe they didn't pursue the job that they wanted because of their NF1, or they felt limited in their options. They needed to choose a job that was in a location where they could be near their NF1 providers versus the job they really wanted, or being unable to work and requiring disability. And with family planning and relationships, we also saw that there was significant concern in this area, where participants felt less comfortable speaking to their family and peers about NF1. They weren't really sure how to bring this up with romantic partners, and they were worried about their family planning and their future children. And I just wanted to highlight kind of how this was assessed. We asked individuals to just answer yes or no to some statements, and you can see on here that we had pretty significant response where individuals were saying like, yes, I resonate with this statement, and this is how NF is affecting me and my relationships. And similarly, the same thing for family planning, you can see the significant numbers of individuals who, raised these concerns about their future children. And we did get free response answers back as well, which were, to me, were some of the most powerful things to read, to just hear in their own words how they feel NF1 is impacting their young adult life. And I'm not specifically going to read any of these quotes to you, but you can read them, and this will be recorded, so you can always go back and read them. So in conclusion, we found that teens and young adults with NF1 do score significantly lower on the validated transition readiness assessment questionnaire than their generally healthy peers, and that they report knowledge and skill, so things they're doing well, in talking to their NF1 providers, managing their daily activities, their general knowledge about their diagnosis, and the genetics and the inheritance of NF1. And those who are reporting better knowledge or better skills in these areas also were scoring higher on the transition readiness assessment questionnaire. So the more that they said they understood about their diagnosis, the higher they were scoring with their transition readiness. And then we realized that we probably need to develop some tools to emphasize how to keep appointments and make appointments, how to track your health issues, to contact your care team, to address emergencies, and talking about NF1 with other people. And that we have to make sure we have some sort of intervention to address school and jobs and careers, relationships and family planning, and that this has to be a multidisciplinary approach, again, with buy-in from the adolescent or the young adult and their parents or guardians, as well as not just the NF1 care team, but adult primary care providers and adult NF providers, disability planners, social workers, financial counselors, psychologists, the list goes on. It takes a village. Our study was limited. We talked about how those factors didn't really allow this to be generalizable to everyone with NF1. And certainly, we did not assess this for NF2 and schwannomatosis. But I hope that we can do further studies and kind of expand and get a better sense of what are the transition needs for individuals with NF1, NF2, and schwannomatosis. So we do want to increase the effort to inform clinicians on the importance of having an effective NF transition program with those two goals of improving quality of life, but also improving health outcomes. And we want both patients, so teens and young adults, their parents, and their providers to all understand what existing resources are available. And because the resources that are available, they're amazing and we're going to talk about them, but they're not necessarily exactly what we need. We still have a long way to go. We just didn't know what we needed until we had these results. And this is, again, just a starting point. So we need to develop additional tools for clinicians and patients. We need to host, transition clinics and have opportunities to facilitate this process. And we need to do a lot more research. So some of the future directions from my study team that we came up with, again, we're just creating these tools, whether it's workbooks, emergency wallet cards, phone apps, tips for talking to others. And then we came up with a list of topics that you could have if you were to have a transition symposium like at your hospital. So, the bulk of we're good on time, and I'm glad, because I was a little worried I was going to use up all the time talking about this study. But I really want to introduce you to what transition resources already exist out there, and leave today with you, either as a teen or young adult, or the parent of a teen or young adult, having at least an idea of what can I do next to start this transition process. And if your child, you might be asking, well, what age should we even start thinking about this? And we would recommend starting to think about this process around the age of 11. And I know that sounds really young, but it takes time to build these skills and to build those comfort levels. And every clinic transitions at a different age. So some NF clinics will transition at age 18. So 11 is probably really when you need to start, because that's not a lot of time. Whereas other clinics will go through 22 or longer, and some clinics are joint, and you might not actually have to go to a different building or see a new doctor, but all of a sudden you're in charge versus your parents. So Got Transition is one of the best, most comprehensive transition resources that's out there for individuals, for parents and guardians, as well as for providers. So I strongly encourage that this is a great resource to start with. You can go to their website, gottransition.org, and it answers so many questions that are just general for all teens who have more complex healthcare needs about what they might need to do to get ready to transition to their adult life, and not just limited to the healthcare setting. And there are kind of introduction, or where should you start? They recommend these 5 steps for just preparing and figuring out, well, what do I do next? Or how do I even get started in talking about transition? So first, they do have a quiz that's on their website, and it's a really nice quiz. It's written in a simple way. If you have an older teenager, they can do it by themselves. If you have a preteen or young teen, you can do it together. It just asks some questions about what they are and aren't doing, and kind of where their comfort level lies. And that allows you to then figure out, okay, well, where is my teen on this transition timeline? And they have one, again, that is just general, but there's also a transition timeline in that new resource from the NF Collective. So you can visit both and figure out where are we at and what can be some of our goals and things to work on. And if you're not sure, you can take the Transition Readiness Assessment Questionnaire, since that is that validated tool that asks questions across many different domains. And your child could do it, your teen or your young adult could, or if you're a parent, you can fill it out too, and just see, you could also see, how do our answers compare? Do you think that your child or your teen is doing more than what they're reporting, or is it vice versa? But that can be a good sense of figuring out what you each are, kind of where you're each at and where you see this going. And then set your healthcare goals, set your transition goals, and talk about them. Talk about them as a family, talk about them with your providers. And lastly, everyone, or not everyone, but many people these days have a smartphone, many teenagers. So I do recommend that all teenagers take advantage of their smartphone's medical ID feature, and just make sure that their NF information is in there. And gottransition.org has a really great resource on how to set up that medical ID on both Apple phones and Samsung phones and Android phones. So great resource there. Young Invincibles is also another organization that I would recommend connecting with. They're not unique to individuals who have more complex healthcare needs, but it's a great resource just about what do you need to know when you go from being a teenager to an adult? Because that's a scary thing, right? Like, even if you don't have healthcare needs, there's a lot of things that you need to understand. And I find their medical insurance resource to be really, really helpful. I talk about insurance all the time as a genetic counselor, and I am amazed by how many parents do not understand how their insurance works. It is common. So this is a great resource to perhaps read together, parent and teenager, or young adult and parent, and just figure out, what are the different types of insurance, what's covered, what's not, what's a copay, what's a deductible, how do I sign up for insurance? Child Neurology Foundation does have a transition of care toolkit. Again, this is not unique to NF or schwannomatosis, but it is designed for individuals who have more neurologic healthcare needs. So it fits well. It's not perfect, but it fits really well. They have checklists, they have assessments, they have places that you can write your goals and your concerns and your action items, and they give you an opportunity of a place to keep your medical records and provide a medical summary. And similarly, the Children's Oncology Group has something that is kind of very similar. It's called a Passport for Care. And this is a great option for any teens and young adults who may have received chemotherapy or were followed by oncology. Like I mentioned, the NF Collective did come together to create a guide for teens and young, preteens, teens and young adults, as well as caregivers for transitioning to adult care. This is just, I took a kind of a screenshot of some of the different pages in there, but you can see that they've broken it down by age range, and they have suggestions of things for the patient as well as the parent and caregiver. And then there are also resources that exist just to learn more about your diagnosis. So, CTF has so many amazing resources, and I'll just highlight that they have a Just for Teens guide that's about living with NF1. St. Louis Children's Hospital also has a transitioning guide that's unique to NF1, so that's a great resource. And then, I mentioned how so many people reported that a big concern of theirs from our study was how to talk to other people about their diagnosis. So how do you talk about NF1 or NF2 or schwannomatosis with your friends and with your romantic partners? First, I think it's really helpful to connect and take advantage of each other. But there are also resources available. And I want to highlight the University of Alabama resource that came from a study they did on NF1 and intimacy. And I have like 1 minute left. So non-healthcare transitions resources are available too. So like I mentioned, gottransition.org has so many resources that are not related to healthcare. So you can find information about employment and finances and living on your own and that special education transition and getting services for college, as well as paying for college. Young Invincibles has a lot of resources for these areas as well. And then the Child Neurology Foundation has an entire section on educational transitions. So what can you do next? So if you are a teen, preteen, or a young adult with NF1, you should talk to the people in your life. Talk to your providers, talk to your parents, your caregivers, your friends, your family about what, that you want to do this, that you want to start taking these steps. You should learn more about your diagnosis and the transition process from all the resources I just went over. Talk to others who have NF or schwannomatosis. Take that transition readiness assessment questionnaire and see where you're at. Set your goals, and then ask questions and never stop asking questions. I just want to acknowledge that all of the data I presented from my study was not just a solo effort. It was a team of amazing women who work in NF, and I could not have done any of this without them. As well as I want to just thank Children's Tumor Foundation, our statistical analyst, Nina Sordanovic, Lurie Children's Hospital, and Dr. Listernick and Dr. Chero, who I work with in the NF clinic, the NF registry, and all of our study participants. And I don't know how we are on time for questions, but I'm happy to answer questions in the chat, as well as my email is up here if anyone would like to contact me.
Thank you, Allison. That was really informative and covered a lot. I love that you incorporated the resources as well and some of the things that are available for young adults and teens who are looking to transition into adult care. We had one question in the chat about maybe you could speak about more specific resources that might be available, or potentially clinicians that individuals should speak with more about family planning and what can be done to eliminate passing on the NF condition.
Yeah, so well, last year or not last year, but 2 forums ago in San Francisco, I gave a whole talk on family planning. So family planning is a great thing to discuss with your NF provider, especially if you have a genetic counselor in your clinic, because that is one of our bread and butter of genetic counseling. Is we love to talk about family planning and all of the options that are available to you and help you make the best decision for you and your family and how you go about doing that. If your clinic does not have a genetic counselor, you may have, a nurse educator or a physician who is very knowledgeable about this area and happy to speak to you about it, or they may refer you to a genetic counselor to go through those options. But definitely something to bring up in clinic, as well as, there are a lot of resources available through CTF about family planning.
Great. Well, I'm sure there may be a few more questions that pop up over the next few minutes. So Allison, if you wouldn't mind monitoring the chat for those, that would be great. Thank you everyone for joining the Pediatric NF1 session. We're going to take a short break for about 20 minutes and we're going to rejoin at 1:45. It will be on a different link. Kate has dropped it in the chat. So please make sure to grab that link. I know I'm going to go and open it right now and then take my break so I have it all loaded for when we come back. And we'll see you shortly in about 20 minutes. Thanks, everyone.